themed session is on a topic we have covered before, briefly at the National Equine Forum, but because it is such an important area of concern to all of us, the organising committee of NAF have brought together this great group of speakers and panel members. Just to remind you that questions to the panel will be taken after the speakers, and then we're being joined at that time by Sara Jerman, who will join us, Sara Jerman, I would say, who will join us here on the panel. So I'm not going to read out everybody's biogs. They are on the programme on the website, but I would like to ask our first speakers to come up, and they are Dr. Claire Stratford and Dr. Alison Pyatt. And Claire is the head of the Efficacy team and Anthelmintic resistance policy lead at the Veterinary Medicines Directorate. And Alison is the International Programme Manager and Training Centre lead, again at the Veterinary Medicines Directorate, and we're very pleased to have you here today. Thank you.
Thank you. Your Royal Highness, ladies and gentlemen, good afternoon. And thank you to the National Equine Forum's organising committee for the introduction to contribute to this very important session on anthelmintic resistance. So we're going to start with a question. Do you think your horse has anthelmintic resistant parasites? Oh, time's up. So we'll pick up on this a bit later in the presentation, but it looked like we were having a sort of 50-50 split between, yes, you thought your horse had anthelmintic resistant parasites, and then either you didn't know or you thought that they didn't. So as part of this presentation, I'll give a brief overview about why we need effective wormers. I'll then outline the current problem of anthelmintic resistance in equine parasites and touch on some key points to consider with your parasite control. And then thinking about the requirement for a collective responsibility to address this critical problem, I'll define the roles of prescribers and the VMD, and then hand over to my colleague Alison to define the role of the wider equine industry and provide an update on the VMD's recent equine anthelmintic resistance stakeholder workshop. So anthelmintics, otherwise referred to as wormers or dewormers, are required to control internal parasites in our horses. And we have 4 classes or types of anthelmintic authorised for use in horses. And we know that high burdens of internal parasites, such as small redworm and tapeworm, can cause disease, such as diarrhea, weight loss, colic, and in severe cases, we can see death. But it's important to remember that the aim of our parasite control is to reduce the risk of parasite disease and pasture contamination, rather than to render our horses completely parasite-free. Anthelmintic resistance is the genetic ability of a parasite to survive a dose of anthelmintic that previously would have killed it. And this comes about through a survival of the fittest mechanism driven by anthelmintic use. So the more we use anthelmintics, the more we accelerate the development of anthelmintic resistance. It's a heritable trait, which means it can be spread from one parasite generation to the next, and therefore perpetuates the problem. So how much of a problem is this? Well, resistance is reported to all 4 of our authorised classes of anthelmintic, and no new anthelmintics are expected on the market in the near future. And there's no evidence to suggest that once a parasite has become resistant, that it can revert to susceptibility. So Lord Benyon said earlier that he considers that this is a significant threat to our equine industry, and certainly uncontrolled, it will lead to critical health and welfare consequences. So responsible use of our existing anthelmintics is essential to maintain future efficacy and slow the development and spread of anthelmintic resistance. Another thing to consider is that anthelmintic resistance is a global problem. So if a neighbouring yard has an outbreak of strangles, we're acutely aware of the risk of that disease being transmitted onto our premises. Yet we don't seem to think the same with regards to the risk of horses bringing parasites onto our premises in their faeces, or in fact, anthelmintic-resistant parasites. And remember, it's the parasites that become resistant, not the horses. So a recent publication entitled The Atlantic Crossing of Macrocyclic Lactone-Resistant Cyathistomins demonstrated just this. So the authors found ivermectin and moxidectin resistance in some young stock in a farm in Kentucky and managed to trace this resistance back to young stock in a farm in Ireland where these young stock were purchased from. So we heard this morning that the UK is a significant importer and exporter of horses, and we heard about the importance of biosecurity. So we need to remember that horses can transmit resistant parasites between yards, between countries, even between continents, and consider this as part of our biosecurity. So before we move on to the role of prescribers in the solution, just echoing back to the quiz at the beginning of the session, where we had this sort of 50-50 split in terms of whether you did or didn't think your horses had anthelmintic-resistant parasites. And I suppose that nobody knows the correct answer because we don't have any recent surveys of prevalence of resistance in the UK. But I think it's safe to say that the majority, if not all, horses in the UK will have internal parasites that are resistant to at least one of our authorised classes of anthelmintic. So whilst this shouldn't be a reason to panic, I hope it underpins the fact that this is a real, it's a current and a very relevant threat that impacts all of our horses and demands urgent collective attention. So then moving on to the solution and the role of different parts of the industry and the importance of this collective response, thinking about the prescriber first. So all our authorised equine anthelmintics in the UK are POM VPS medicines. That stands for prescription-only medicines that can be prescribed and supplied by vets, pharmacists, and suitably qualified persons, otherwise referred to as SQPs or RAMAs. And we'll be hearing more about the veterinary perspective from Dave and the RAMA perspective from Claire in the next talks. We know that most equine anthelmintics are currently sold by SQPs, with less than a quarter being sold by vets. And anthelmintics can be purchased in person and online. But regardless of your choice of professional for prescriber and your choice of purchasing route, it's the prescriber's responsibility to select and prescribe the most appropriate anthelmintic for the horse in question. So, for example, taking into consideration factors such as age, management status, pasture control, and previous anthelmintic or diagnostics that have been performed. And in some instances, the answer may be that an anthelmintic is not required at that point in time. So prescribers can play a really key role here in driving responsible use of anthelmintics. And we also need to encourage and prepare our horse owners so that they're ready and expect this point of sale interaction with their prescribers instead of just going with the idea of a particular purchase of an anthelmintic in mind. In terms of the role of the VMD in the solution, the Veterinary Medicines Directorate is the regulator for veterinary medicines in the UK. And we set and enforce veterinary medicines regulations. So this is legislation that governs various aspects associated with veterinary medicines, including anthelmintics, such as their authorization to check their sufficient quality, that they're safe and that they're effective, their availability in terms of who can prescribe and supply them, and how they're advertised. The VMD also acts to promote responsible use of medicines and is the UK lead for antimicrobial resistance. We sponsor anthelmintic resistance research to underpin effective control practices, primarily in the livestock sector. And in response to the growing concern over anthelmintic resistance, we've recently formed an internal anthelmintic resistance working group. And this group is working to raise the profile of anthelmintic resistance as an issue, to scope national and international anthelmintic resistance activities to identify whether we can collaborate or learn from these, to consider whether regulatory changes or clarification are required, and to promote coordinated action to address this critical problem. So I'll now hand over to my colleague Alison to describe the role of the wider industry in the solution.
Thanks, Claire. Thank you. We know that across the livestock sector that anthelmintic resistance has long been a problem, and this is identified globally. With that in mind, across the UK, the livestock sector adopted pan-industry approaches which over time have proved to be very successful, and these are scops and cows respectively. But as we've heard repeatedly through our conversations this morning, our speakers this morning, we know that the UK industry, equine industry, is both diverse and extremely fragmented. So that then poses the question around, could a multi-stakeholder approach work for our sector? With this holistic approach in mind, we sought to convene a group of representatives of stakeholders from right across the equine sector. And we were able to bring together over 45 delegates representing 30 different organisations across the equine industry. And I can see lots of people looking for their logos on that motif there. We were very fortunate to receive representation from right across the sector, from governance, policymakers, from registration bodies, SQPs, academia, diagnostics, retail, pharmaceutical sector, thoroughbred sector, and also horse owners and academia as well. So we were very fortunate to be able to bring all of those people together. We convened a stakeholder workshop via the beauty of Zoom, and we held a number of guest speakers initially at the first part of the day. We welcomed Professor Martin Nielsen from the Gluck Equine Research Centre in Kentucky to give us the global perspective, Professor Jane Hodgkinson from the University of Liverpool to give the UK perspective. Then Leslie Stubbings, who is a sheep consultant in the UK, who has been pivotal in the development of the SCOPS campaign. And then our own Dr. Kitty Healy, who's our head of antimicrobial resistance, to talk about the lessons learned by the VMD in how to promote awareness and behavioural change in antimicrobial usage. Following on from the workshop, we then, from the guest sessions, we then went on to run a series of facilitated discussions around 3 main topics. The first one was around the present situation, so where we're at now. Then to talk about general anthelmintic use and prescribing behaviours, and then also to consider how we make progress. And there we have an image of the breakout rooms, and we were extremely fortunate to have very enthusiastic and engaged and detailed discussions throughout the course of the day. So first of all, the present situation. What was very positive was that over the last 10 years, all of our stakeholders reported improvements in the way in which we approach anthelmintic resistance in horses, with evidence of increased diagnostic uptake by horse owners, including things like fecal egg counting and saliva testing in their horses, general increased awareness across prescribers and also horse owners alike, improved education via availability of online learning materials. And we found also that our stakeholders were adopting their own best practice guidelines, and they had those developed. There's improvement reported in the prescriber horse owner interface, and also enhanced contribution from the veterinary pharmaceutical companies. And generally, horse owners were seeking to improve their pasture management and hygiene techniques. Notwithstanding these positive changes that we've seen within the last 10 years, we also found that we have a critical problem still within anthelmintic resistance in equine parasites. So that tells us that we're not doing enough and we need to do more. So we went on to consider the core problems, what those core problems are. The fragmented sector of the equine industry and the husbandry challenges associated with the diversity of the yard types that we have. So the differences between keeping horses on a DIY yard versus a training or a breaking schooling yard versus a stud. Still improvements to be made around information and education available. Online sales were a concern, and also there's differentiation in fecal egg counting and the need for that process to be standardised to give greater confidence in the reporting process. We said that many horse owners are adopting best practice, but equally there are many who are not engaged in this problem, and we need to understand how to bring about change behaviour. And also there was reporting of an increased use of herbal wormers. Moving on from those questions, the next point was to work out what to do next. What were our priorities? What were our agreed contributions? Stakeholders were extremely enthused to follow up on initiatives, and one of which was to adopt a joined-up approach, a pan-industry group that would work together with representatives from across the sector to move to help us to tackle this problem. Best practice guidelines were highlighted as a key starting point for us, and also then how we would communicate a consistent message for our horse owners to raise the profile of this problem. Our next steps, so where do we move to now? We've shared the workshop outputs already and they're widely available online. After today, we'll make these available via the NEF website if anybody wants to go through and read the paper. We've been able to develop the key themes for future work and also to further consolidate our research priorities. In our next meeting, which will take place in the middle of March, we're looking to obtain stakeholder agreement on their own level of involvement and engagement, so how we move forward practically. We know that this is a critical problem, and we know that it needs an urgent response, and we've been doing all that we can, but we still need to do more. Claire and I, both as horse owners, we know that equally, as a multi-stakeholder approach is needed, that horse owner engagement is also extremely crucial to the solution. If you're interested in following this project forward, because it is going to be a long-term project, please do look out for the Twitter hashtag, and we also have a specific email address that you can contact us on if you'd like to be further involved in it. But thank you for your time this afternoon.
Thank you very much. It really is showing how you're initiating this coordinated response, because the whole theme today is about our collective responsibility. And so our second speaker is David Rendle, who is the President-elect of the British Equestrian Veterinary Association, and he's going to present on the veterinary perspective within that collective responsibility.
Your Royal Highness, ladies and gentlemen, thank you very much for inviting me to speak on this subject at the National Equine Forum. It's fantastic to be invited to speak on this again. And I'd say it's really, really encouraging to hear the mood music in the room, that people seem to be aware of this issue. I think, at least within those gathered here, there seems to be a real change in the last couple of years as to how people are appreciating the significance of this. I fear perhaps the wider equine industry isn't quite on the same page and don't necessarily appreciate the urgency and the importance of the situation. But I just wanted to start with a little bit of terminology. We talk about targeted deworming, we talk about diagnostic-led deworming, we talk about risk-based deworming, and I think that is confusing, and I think we do need to develop a consistency of message. But we're essentially talking about the same thing with all of those terms. We're talking about keeping chemical treatments to an absolute minimum to prevent disease in our horses. We know that traditional strategies of deworming result in 80% of doses being completely unnecessary. There's plenty of scientific data to support that assertion. And unfortunately, there are also multiple surveys, not the most recent, but surveys to demonstrate that the use of diagnostics in owners, whilst it's been improving and potentially up to 60% of horse owners are using them, unfortunately, the way diagnostics are integrated into deworming plans is not good, and as little as 10% of owners may actually be integrating those diagnostics appropriately into their plans. So there is a real disconnect. And Beaver set up a working group to look at anthelmintic resistance in 2018. One of the first things that we did was to try and quantify what horse owners were actually doing in terms of using diagnostics, worm egg counts specifically, and what they were doing in terms of using anthelmintics. And we followed the trend over 2015 to 2018, and encouragingly, we demonstrated that there had been a 30% increase over that time in the amount of worm egg counts that were performed. So that's great. Looking at dewormer doses that were administered, though, there wasn't an obvious trend. Over the 4-year period, we had a 3% reduction, but that reduction was within the normal variance year to year. So there was no convincing evidence of a decline, which is what we would expect or should expect if there's been an uptake in the use of diagnostics. I think when we look at the relative use of dewormers and worm egg counts, we start to get a bit more worried. In the UK, in the last year of that study, we used 1.13 million doses of dewormer, and Claire Williams might correct me on my numbers, but these were the numbers that we came out with, compared to 120,000 worm egg counts over the year. So that's 11 dewormers for every worm egg count that's being used. Now, everyone in this room knows that that ratio is grossly round the wrong way. A rule of thumb, and I'm generalising, but we should be thinking about using approximately 4 worm egg counts for every dewormer that we use. So we're 11 to 1 the wrong way round when we should be 1 to 4 the other way round. Some people don't like numbers, so at risk of being patronising, I think it's easy just to show some circles that correlate with the volume of use. So dewormer is clearly the biggest circle there, and this is where we need to get to. This is our requirement if anthelmintics are going to be sustainable, dewormers are going to be sustainable going forward in our horses. So we need to flip it right about. And as a direct result of the National Equine Forum in 2020 and discussion that followed on from that, Tamsin Furtado, who's a social scientist at the University of Liverpool and a horse owner, did some work which I supported her with, reviewing the evidence around dewormer use and the publications that there are, and relating that to a COM-B model of human behaviour. I'm not going to go into that in any great detail, but using models of human behaviour and looking at how owners approach deworming in their horses. And unfortunately, one of the conclusions from that piece of work is that education alone doesn't work. Unfortunately, we tend to preach to the converted, and the majority continue doing what they're doing. And that might sound defeatist, but that's what the science is telling us. And the desired behaviour that we're asking for, a diagnostic-led approach, is more difficult, it's more complicated, it takes longer, it's perceived as being more expensive, it has no immediate benefit to the horse owner, and unlike in the livestock sector, there's no ultimate incentive for horse owners to engage with what they're asking them to do. So unfortunately, the science would suggest that on that basis, horse owners aren't going to change their behaviour. Things have to be easy if they're going to change what they're doing. So the conclusion, and the science would support the fact that there have to be some kind of barriers between owners and the acquisition and use of anthelmintics. And it's perhaps the elephant in the room, and it's an unpalatable truth that we maybe also have to look at our own behaviour and look at whether healthcare providers, and I use that term deliberately to include vets with SQPs, RAMAs, will we change our behaviour? Because the behaviour for us in talking about this subject and proposing diagnostics rather than just treating is more difficult, it's more complicated, it takes longer, it's going to require a lot of investment to do it properly, and ultimately it's going to be less profitable. So where is the incentive to make that change? And I hope I'm being overly cynical, but are we naive to think that everyone is going to work for the common good, even when you can't make a commercial case for going down this route? Others have adopted a more radical approach. In other countries, they have concluded that legislation is the only way forward to affect behaviour change, and this is clearly controversial. But in Denmark, they changed legislation, and it resulted in a dramatic increase in the use of diagnostics and a dramatic reduction in the use of dewormers. In Sweden, a similar thing, 60% reduction in anthelmintic use, dewormer use over 10 years. And I think it's important to point out that in Sweden, medicines are not sold by vets. So I'm not making a case for vets monopolising the sale of dewormers. What we need to do is change how we sell dewormers, not necessarily change who sells them. It's the approach that needs to change. Interesting to hear earlier on that Ireland is also making changes in this area and changing the way that it's prescribing anthelmintics. So we need to get from A to B, and we could be radical, we could make legislative change, but Claire and Alison indicate that there isn't appetite for that change, or it's not practical to make that change at the current time. So the industry is going to have to work together to get there. Fundamentally, what we need to do is move from a situation of ad hoc transactions with horse owners to a situation where dewormers can only be used within an annual health plan that has diagnostics at its core. And that plan needs to apply to populations of horses, and it needs to work across the whole group of horses. Coordination across the group, coordination over time. We need recording and integration of diagnostic test results. At the moment, most providers aren't able to look back over time and look at the results of other horses on the property. We need some way of recording this data in a database. We're going to increasingly need to react to episodes of disease, which are going to be increasing, and also reports of confirmed resistance, which are going to be increasing. And I think as we see more resistance, as we see more clinical disease, it's going to become a requirement that we start thinking outside the box, using medicines off-label. We're going to have to start integrating more complex diagnostics. And it's going to get murkier and murkier, whether we're talking about health and whether we're talking about disease. And I think there is going to need to be more veterinary involvement. So I've stolen this slide from Claire. I hope that's all right, Claire. And I'm not going to go into the detail, but what I just wanted to highlight, and Claire will talk about this in the next presentation, is just the complexity of this issue, the number of parasites that we have to deal with, the number of drugs we have available to us, which we would like it to be more, but it's not going to be. And just look at all the different subscripts there in Claire's table and the different ticks and crosses and colours, just trying to get get a handle on this situation. It's complicated. We take the administration of dewormers for granted, but you've got to be really on the ball and have a really good understanding to be able to appropriately make plans for deworming horses. And then you throw in all the risk factors at a horse level and a property level in determining what is best practice in that situation. And everyone wants a one-size-fits-all deworming plan, but you are just not going to get that. There are too many variables, which is why we have to dispense dewormers within the context of a well-thought-out plan. So I'm going to just present a case example. This is a genuine example from a colleague of mine on Beaver Council, Miss Smith. That's not her real name, from Suffolk. She bought a 2-year-old from stud, and it arrived with ascarids in its feces. Her response to that was to buy the cheapest wormer from an online pharmacy to give it. Unsurprisingly, there were still worms in the horse's feces. It didn't work. She then went to a local retail outlet and was given, and I know there's going to be gasps in the audience, she was given 60 wormers for the following year to be used at 2-month intervals to treat the horse. Now, I accept this is going to be an outlier. I hope this is an outlier. And again, because of the classes of drugs that were dispensed, worms reappeared within a couple of months. She then consulted the veterinary practice who deal with the yard, and the vets identified that there were resistant ascarids that had been introduced from the stud. They organised a plan for all of the horses on the yard in partnership with the yard owner, so involving not only the owner of the individual horse, but now starting to look at a population level. They identified the horses that had high parasite burdens, and they treated them accordingly, and in treating them, they also assessed the efficacy of that treatment against the parasites to check for resistance. The vets advised against treating the other horses that didn't need treatment, and in so doing, overall, over time, they reduced the cost of deworming on the yard, and they reduced the use of dewormers. So that's good, but unfortunately, the resistant parasites on that property are then there to stay. I was shocked by how easy it was to acquire those dewormers. So I found out what they were, and I then went into to a local retail outlet near me, and I was flabbergasted to pick up those 6 wormers without any questions being asked. And they don't know I'm a vet. As far as they're concerned, I'm a sheep farmer. So I was pretty horrified that it was that easy to pick up those products, and I do hope that is the exception and not the rule. But in that case example, the vet comes out well, but I'm not trying to make the point that vets can do this job better than anyone else. And just to highlight the fact that it is a how and not a who discussion, I just want to highlight that this is the footer from one of the biggest internet pharmacies. And this is an internet pharmacy that is accredited by the VMD, Claire and Alison's organisation. And the medication that they sell is dispensed under the control of veterinary surgeons. So we as veterinary surgeons are dispensing a large quantity of anthelmintics, the majority of anthelmintics, through internet retail outlets. Sometimes it's pharmacists. But I'm not saying that vets aren't part of the problem. The whole industry has got to work together to tackle this problem. But internet sales, as Claire and Alison already mentioned, are a real issue in my opinion, because it is so easy to acquire dewormers online. There are a number of predetermined questions that you have to answer, and then you are sent what you need to get sent. There is no plan, there are no diagnostics, there is no advice, and you're even encouraged to have regular drops of those products, which is encouraging unnecessary use of dewormers. So this situation really does have to change. So what are vets at the coalface doing? Well, I can tell you vets at the coalface are infuriated at that previous kind of behaviour and the fact veterinary surgeons are associated with that. We did a survey last year of Beaver members. It was a more general survey, but there were some questions in there on dewormer use and our attitudes to that. And that membership survey revealed that among UK practicing vets, 85% had a programme of diagnostic-led parasite control in place within their practice, which still leaves room for improvement, but I think was a pretty encouraging figure. 79% of those vets were aware of the work that Beaver are doing on that score, and we've got more work coming through with toolkits and with current guidelines on best practice. And 90% of our members, yes, it was our members, equine vets, believe that restricting the availability of dewormers would help to improve equine health and welfare. And I think we can see the writing on the wall. We've been here before with ruminants, with sheep and with goats, not so much in the UK, although it's increasingly becoming a problem. But in the southern hemisphere, there are pastures that ruminants cannot graze. Within boar goats, there are particular problems with chronic endemic disease caused by parasites that cannot be treated. And there is absolutely no reason why horses will be any different. The writing is on the wall, unfortunately, for more deaths, more disease, and pastures that cannot be grazed by horses. And we know that some of the pastures in the UK have been intensively grazed, particularly by young stock, year in, year out. Those pastures potentially are going to become unfit for use in horses, which is going to have a radical and commercially very important effect on the structure of the equine industry. So the writing is on the wall for all of these things. Something else which I think we need to touch upon, there isn't really time to go into it in any great detail, but a lot of these chemicals that we use in our horses are ecotoxic. They kill invertebrate life and they kill a lot of aquatic organisms. So our liberal use of these undermines our social license to keep horses and other grazing animals. So the issues of ecotoxicity and the threat to the environment goes hand in hand with anthelmintic resistance. We need to tackle them together to reduce the amount of these chemicals that we are putting into the environment. And this is something the BVA have also been doing some work on recently in small animals. So it is a cross-species issue. So how do I summarise the vet perspective? Well, I think all vets would stand with me in encouraging us to discontinue the ad hoc sale of dewormers. We have to ensure that dewormers can only be purchased and used within a well-considered diagnostic-led plan. And I just make the point again, it's not a case of who sells these products, it's a case of how we sell them. And the industry really has got to shake up how we sell these products, and the industry has got to make these changes fast. Thank you.
Thank you very much. We will now move to the third of our presentations in this session. And here, Claire Shand, who's the Marketing Director for Westgate Labs, she's going to give an equine registered animal medicines advisor's perspective, a RAMA's perspective. Thank you, Claire.
It's a snappy title, isn't it? Good afternoon, Your Royal Highness, ladies and gentlemen. Really pleased to be here today to give a RAMA's perspective. As Pat said, I'm a director at Westgate Labs. We're a company specialising in parasite control for horses. So it was my parents that set the lab up 23 years ago now. We were using these techniques in our own horses and really wanted to make them available and make the change happen much more easily so that everybody could employ these techniques with their horses. And we back that up with our award-winning advice because it's not just about the tests themselves, it's what we do with it that really counts. So, I am a RAMA or an SQP. We've got two confusing titles now rather than one, it would seem. And there are 8 of us in our business that give advice on worming and plans and strategies to help people with their parasite control. But through the country, there are actually 6,500 of us. We're in feed stores and saddlers and anywhere you buy your wormers. And anyone should be able to give you advice on planning a parasite control program for your horse. We're not vets, we don't diagnose, but this is an area of horse health that we do know a lot about. So the science of testing, unlike the chemical side of things, is actually really on our side. And one of the great things is what we are being able to do now to pinpoint the wormers given to horses. So we've got about 82% research is showing of wormers can be reduced by the use of fecal egg counts. It's now 8 years since the Equicell test has been available. And again, that's given us some really good advice or some information along these lines about the number of horses that now aren't getting a treatment that would have had to have one previous to that. And in 2019, this new blood test was launched for small redworm onto the market, and that actually identifies encysted stages of the small redworm as well as the egg-laying ones that can be found in the worm egg counts that we do. So all this is really, really good news when we can no longer rely on giving the chemicals and them being effective. So what does that mean? Really, there is absolutely no place anymore for regular chemical programs. So as a RAMA, instead, what I'm looking to do when horse owners come to me is to put together a test-based program which identifies the average 20% of the horses that are carrying these 80% of the worms. So that identifies the high egg shedders, and then we can target those appropriately. And we'll find that in a herd of horses all kept the same, actually there'll just be a certain small number, generally, which are going to need the treatment. And usually they're the ones every time that are coming back. And that can be a complex mix of genetic, behavioural, age, immune status, all sorts of sort of things that add up to that. And then we're going for the right treatment for the horse and the parasite and the time of year. So really, we're looking to make testing the centre of a targeted parasite control programme. And the humble worm egg count really is the cornerstone of that. They're very cheap to do, usually cheaper than the cost of a wormer. They're very actually straightforward. And one of the things we've tried to do within our business is to help make that as easy as possible for people to work out with their horses. It's a single snapshot. Single worm egg count is a really useful snapshot, but actually it's a series across a season that really starts to tell a story. We can also use them as reduction tests to monitor the efficacy of the wormers that we do need to give. So following up and actually getting some sort of percentages around the chemicals that we're using and the level of resistance that's there to them. Number 2 would be the tapeworm testing. So this is more regularly done now as a blood test. We're going to the other end of the horse. And this is measuring the antibody levels that the horse produces to the tapeworms that are present in the body, and then giving us a really clear indication of whether we need to test or not. And then third is this blood test for encysted, well, it's for small redworm, but specifically the encysted stages that it detects. And hopefully we're only now being advised to test the low-risk horses, but even still, if we're helping horses not have a wormer, it's helping us to preserve key medicines, and that can only be a really good thing. This is a blood test. It's done via vets, and the interpretation is done via vets as well for the serum score that produces. So we've got these other 3 that are available to us as well to detect pinworm, lungworm, and liver fluke in horses. And really, apart from BOTS, which is the only parasite of horses that causes disease, that we can actually identify on the horse itself, the little eggs that are laid on the hair, that gives us a really good overall testing plan rather than stepping in there with treatment straight off. And healthy adult horses can follow fairly straightforward testing plans. So looking there seasonally, our worm egg counts in, our late autumn winter for our encysted redworm, and then our tapeworm every 6 months, whether that be spring and autumn or summer winter. And then the added one in there is to start to look for trouble, get these reduction tests in so that we can then start to know much more about the chemical status in our horses. So as an SQP, one of the things we have to do is to ensure that people can dose appropriately and responsibly. And we're looking to help people do that. Do they know the weight of the horse? Because if we're underdosing, it's another surefire way to make sure that for resistance to grow. And I thought I'd illustrate this with a very unscientific Facebook poll that we ran. My pony is a Highland. He's quite chunky, but he's only 14 hands on his tiptoes. So what did people feel he weighed? And actually it was really interesting to see like the huge variety within that. So very much encouraging people to get a weigh bridge, use a tape, anything to help to get that right. Obviously using the right chemical to protect the key medicines, and looking at giving them on a surfaced area. So has the horse had sufficient wormer? Did it spit any out? And going back again to the point that David was making about how poisonous the wormers are, both to the critters in the environment, but also to our dogs as well. You know, we can take care with that when giving the wormers. And again, getting those reduction tests in. So yeah, best foot forward. The way that we manage our pasture can also have a really big impact on breaking the life cycle of the worms mechanically, rather than relying on the chemicals. So like the poo picking, sorry guys, is really, really where it's at. And it does have a massive impact on the parasite burdens that are there on the land. So we're taking the eggs off at least twice a week before they have the opportunity to hatch, wriggle away, climb up that blade of grass and infect our horses. Harrowing really in our climate is not effective for parasite control, unfortunately, because it just seems to spread the eggs around the pasture and actually make it easier for them to get inside our horses. Otherwise, we're looking to rest and rotate our grazing and cross-grazing with sheep and cattle and all those other good things that are going to stop parasite challenges coming into the herds of our horses and infecting them. One of the big ones is not worming and moving horses. It's often very tempting when we do give a wormer to want to move a horse straight onto fresh pasture. And actually what that does is it prevails for the resistant worms that are already in the horse because they've survived the wormer dose. We move the horse and they have the opportunity and the space to flourish, whereas actually what we're wanting to do is for the horse to get a mixed population of susceptible as well as the not susceptible worms back inside of it, remembering that we can't actually get to zero parasites within the horse. We're looking at managing that at an acceptable burden that's not going to cause disease there. So it's a bit of a strange one to get your head around. And then it's really about thinking not just about the health of the horses that are in front of us, the environment that is directly in front of us. It's not just about the yard. These are some of my horses. They've heard all this before. All horses need good parasite control, from cobs to competition horses, but really it's the future generations that we need to be doing this for and acting now so that we can continue to keep the horses on our fields and our lands that we graze into the future. So my question for you really today is, what will we do when the wormers stop working? Please let's not wait to find out. And if it is time to worm, we need to think worm count first before we're reaching for those drugs. So if you need help, it's vets, it's RAMAs, and going to places to seek advice really is the key message.
Thank you. If I could ask the speakers to come up, and also to welcome again Sara Jerman, who's the Assistant Centre Manager for Glenda Spooner Farm for World Horse Welfare. Thank you. We have lots of questions on Slido, but please do. And I'm going to start actually with Claire and Alison with a question as, should we be using shock tactics to convey the severity of this matter?
Question, isn't it? I think that shock tactics will work, and this perhaps comes back to some of the work that Tamsin's been doing, Tamsin Furtado's been doing on behavioural change. And shock tactics will, I'm sure, work for some people, but for other people, perhaps they'll generate the opposite response, and too much scaremongering might not necessarily always result in the outcome that we want. So I think that for some that will work, but for others, maybe less so. I think Claire has...
Yeah, from a marketing perspective, we know that there are like the road safety campaigns that they've done. They've actually gone away from the shock-based tactics because they found that if you instill fear, you get short-term take-up, but people don't learn when they're afraid. And actually, if we're using a softer approach that is more about knowledge and learning and long-term, then they've actually found that that's a better way forward. And certainly with the marketing that we've been doing, we've found a similar...
Yeah, I think the science does support that in this area. I think we're all guilty of suffering from an optimism bias, and they do use this a lot in driver awareness campaigns now. We're all optimistic. We don't think we're going to have an accident. We don't think we're going to be the ones that get caught speeding. And similarly, we don't think we're going to be the ones that have horses with anthelmintic resistance. So it does work for a very small subsection of the population, but generally it's ineffective.
Thank you. And I'll start with you, Dave, again. Why is it difficult? I mean, we've heard a bit, but why is it difficult to not have a scenario that fits all horses? Really what people are asking, why do we need a targeted approach?
We need a targeted approach to reduce the amount of anthelmintic dewormer that we use, otherwise they're not going to be sustainable for much longer, and we're talking years, probably not decades. The second part of the question, why we can't have a single one-size-fits-all, I think that comes back to the couple of slides that I put up. Firstly, the one I stole from Claire, showing all the different variables with respect to the parasites and the drugs, but then also the subsequent slide with a great long list of different risk factors that are related to the horse specifically or to the management on the property. Every property is different and every horse is different in some way. They have different levels of immunity, they have different levels of exposure, they have different cohorts, they have different amounts of movement. There are so many variables that unfortunately there isn't a one-size-fits-all. And if we do try and implement a one-size-fits-all, then we have to over-treat because we have to adopt a precautionary principle. We have to protect those horses, give them more doses than we would ideally like to. So the more focused we can be on the individual and on the property, the better the outcomes we're going to get because we're going to reduce the amount of dewormer we're going to use.
And Sara, taking up on that, what about, if you're bringing a new horse, or for you, how you take these general principles with a large group, a small group, because you have all of that?
Yes. Well, with the large groups, I'd say that from my perspective at World Horse Welfare, it is possible to use a targeted worming program. We have between sort of 70 and 100 horses on our particular farm in Somerset. We will fecal egg count 4 to 5 times a year and use a targeted approach there. So I think where there's bigger yards that may use blanket worming, thinking they can't do it and it's not easy to do, it's too time consuming, it can be done. We have a small amount of staff that work with those horses, so it is a possibility. I think with the groups as well, there's so many different considerations to sort of take into account, such as the size of the land you've got, how the grazing's managed, whether you're able to rotate it, the age of the horses there. With regards to sort of new horses coming into the farms, I think isolation is key, and I think something Claire said, I think we look at isolation as when we're looking at other diseases such as strangles, but parasite biosecurity is really important. So we'd look at sort of the 14-day isolation, and in that time, your vets can do a full health check. They can take the fecal egg counts, they can do the ELISAs, they can take the blood tests. And they're also looking at that horse, whether it's compromised with its health in any way, what weight is it, if it's underweight. Younger horses are obviously more susceptible, and the same goes for really much older horses. They're likely to have a higher worm burden, and especially if you don't know their backgrounds and their history. In that time, I think as well, you could use the reduction test. If they're in isolation for 14 days and you have used a wormer, you could then use the reduction test as well to find out whether that worm is working. I think the other consideration is that if you don't know the history of that horse, where are you going to then be putting it into a herd? Is that herd a stable herd? Is it a herd that's got targeted worming? If you've got a youngster, you don't really want to be putting it in with another load of youngsters. So ideally, there's so many considerations there.
Any adding, Dave?
I think that was pretty thorough, Sara.
I think this has come up a couple of times, but many owners basically are on yards. They don't have a choice. And I think the question is really, how can we support yard owners to use this targeted approach? And I'd start with you and then carry on to the panel.
Yeah, I think that's a question and a concern that's come up repeatedly across many conversations that we've had around the challenges with horse owners knowing that they should be doing one thing but not actually being able to do another thing because of how the yard is organised. And that's something that we need to understand more about. We need to understand where the barriers lie and how we best communicate with those perhaps livery yard owners who might not be quite so open to changing the strategies that they've been using for a number of years. So we need to understand how we can reach out. I mean, in our presentation, we spoke about lots of good practice, but equally there are those who are not engaging, and how we reach those is something that we don't quite have the full picture for yet. There's been lots of extremely effective work being completed within the livestock sector, particularly how we vets, SQPs communicate with farmers, and we're some way behind our level of understanding in the equine sector as how we communicate effectively with our horse owners to bring about change in behaviour.
Yeah, I think as well we need to think about how we actually support those yard owners and yard managers that are trying to do the right thing and have, you know, a large number of horses and a large number of owners with different perspectives to sort of marshal. And we've heard how complicated it is to perform targeted worming, and so within a livery yard you're likely to have all those different risk factors within those individual horses. And a livery yard owner that's setting, with the help of hopefully of their prescriber, prescribing or a worm control plan for their premises, that's a really big responsibility for that person to take on, and we need to think as to how we can better improve that relationship between the yard owner and the prescriber so that they can be having these targeted best practice approaches without so much significant onus on the yard manager.
Yeah, I think it's a really good point, Claire. I think the yard owners have to get a bit more militant, if I'm brutally honest, because at the end of the day, it's their property, and if they get multi-resistant parasites on that property and they can't keep horses on it, they don't have a yard. So ultimately, they have the most to lose. So I think they do have to insist that all horse owners comply with their recommendations. And I think particularly in a livery yard setting, I think vets do have an advantage that we're on and off those properties and often have, God forbid, some sort of understanding of the politics on some of those yards quite often, and we can work with the yard owner in trying to navigate our way through some of those difficulties. And I think it's also important to remember that we don't look at parasites in isolation. I've got Richard Newton staring at me, and in the context of an annual health plan, we can not only consider parasites, but we can consider influenza, herpes virus, strangles, all the other things that these yard owners need to consider. And increasingly, yards are realising that they do have a degree of legal responsibility towards the horses on their properties, and they need to take control of those threats to the horses that are there. So I think that is where I look with a degree of green-eyed envy at the animal health and welfare pathway that's now being rolled out for the livestock sector with paid-for vet visits to look at all of these issues. And it would be great, as David started to outline earlier on, if we can move in that direction with horses. Sheila's nodding. We'll take that as an acceptance. We shouldn't be looking at these parasites in isolation. We need to be looking holistically at the health and welfare of the horses on those properties.
Dave, it might just be worth also highlighting at the moment that there are initiatives across Wales bringing veterinary free health checks to yards within Welsh equine sector, where they're going on the back of antimicrobial resistance, but they're going on to do biosecurity appraisals, and I'm sure that those will hopefully incorporate anthelmintic resistance discussions as well. So there is some movement in this area, but we're just a little way behind the livestock sector.
Yeah, I would just say that livery yard owners are sometimes hard people to influence in terms of the media they consume and where they're at, just in terms of getting messages across. We do test for quite a number of different yards and very supportive of them in terms of checking in with annual programs and support and that sort of thing. But what we have had success with is actually getting the bottom-up approach as well. So really getting individual horse owners to want to push to do this and to go and request that of their yard owner. And often if it's a multi-approach, we find that the yard owner, it's not a big a deal as they first thought it was going to be. Actually, it's much more warmly received because people are wanting to move that way. And then with help and support, it's not as difficult as it could be perceived to be to make the change over. And there are the added benefits that are accrued with that as well. So it is positive, but you just have to take that first step.
And sorry, this sort of plans when you're rehoming a horse, how do you help for them to know what do you do there?
Well, with the rehomers?
Well, and with the livery, if they're going into a livery, how do you support them, I suppose?
Well, we go through a sort of a structured programme before we allow the horse to go out on a home. So we talk to people about what they use at that time, and then if we think we need to guide them and give them a little bit more advice, and we will. And then we also send them out with what the sort of advised a programme that we would use, and we also have the Westgate Labs leaflets that go out with them as well. So we put a lot of trust in people, so hopefully they will do as much as we ask them to do. So the advice is there. And obviously they can come back to us if they need to.
Thank you. And Dave and Claire, what information do we as horse owners need to give you as a vet and a RAMA so that you can do the best plan for us? You know, so what are we really asking for? Who wants to start?
It's an outline of the horse that's presenting, so you need to know about, it's identifying the parasite risk that they would be at. So it's the age of the horse, its health status, it's where they're kept, how they're kept, whether they're out to shows, anything that's going to potentially bring parasite challenge back. Are they grazing individually? Is there poo picking? Like, all of that is really useful information when you start to try and unpick some of the more complex situations.
It really is a full picture of the signalment of the horse, so its age, its type, and also all the management factors on the yard that we've talked about already. And in addition to that, we also need temporal information. This is what I was driving at earlier on, talking about the need for data collection and a database. And this is something, I guess, as vets, again, we do because we have practice management systems, but it's going to need to be a change for wider prescribers if they're going to have to collate historical fecal worm egg count data, not only ideally the results for that horse, but also the other horses that are kept with it, the treatments that's been administered, any episodes of clinical disease, any confirmed resistance. All of this has to be factored into the decision making for that horse individually and the plan going forward. So it is complex. For a lot of years, we've been trying to educate horse owners as to what the parasites are and what the drugs are and when we use this one and when we use that one. I think we just have to completely get away from that and just accept that this is complicated and you need to pass it over to someone that is abreast of all the issues and allow them to develop a plan for you. And that doesn't need to cost much money. But I think gone are the days where we should be trying to educate horse owners to make the decision. I hope that doesn't sound patronising, but it just gets ever more complicated.
I would disagree a little bit on the education of horse owners. It depends on the person, I guess, but there are some people who've really got it down and can follow that, and I guess it's about judging your audience for sure.
There's another question which picked up a bit from earlier, and it's saying this afternoon any of us could go online and order 200 wormers, pretty much any wormer, no questions asked, given what we should be asking and answering. So how can this happen? And in a way, not that we're talking about what we can do legally, but what can we do? And over to you.
I think that's you. Well, certainly we've heard today what optimal prescribing should look like, but as has just been demonstrated, we know that optimal prescribing doesn't always happen in practice, whether that's an in-person sale or an online sale. And how we tackle that, I suppose, is the $90 million question, but probably comes back to this idea of a collective responsibility here. So we've just heard as to what the horse owners should be going to their prescriber, be that in person or online, what information they should be taking. And Claire's suggestion of trying to push this from the bottom up, in that should be the horse owner's expectation that they're asked for that information and that they vote with their feet if that's not what they're asked for or they challenge. Then moving on to the prescriber, again, Dave outlined all the factors which make targeted worming less attractive for prescribers, less attractive for owners in terms of the effort it involves. And I suppose we need to set a greater expectation with our prescribers. So, for example, writing into the codes of practice for SQPs and for vets that there is an expectation that they ask these questions at the point of sale. But also equipping them so that they're actually able to ask them and respond appropriately. Dave's described it's very complex, it's an evolving field, so we need to make sure that our prescribers are educated, kept up to date, that education is available, and so that the advice that the horse owner is getting is similar regardless of the prescriber that they're going to. And then I suppose there's the regulatory side in terms of, can we do more from the regulatory perspective to tighten this up? It's certainly a discussion that we have at the VMD. It's a subject that we discuss as part of our anthelmintic resistance working group. That are there areas of the regulations or the guidance that can be tightened or that can be clarified? That's part of our scoping activity to understand what's being done in other countries where they have stricter legislation. It's not quite as nice as Dave outlined in terms of the positive messages. Those that have tighter controls have restricted use, but there have been other complications associated with that. And we've seen a recent questionnaire study that's looked at the difference or the interplay between
the legislative framework and the parasite control practices and stricter legislative framework hasn't necessarily resulted in improved parasite control practices. So that's why the whole theme of this session in terms of collective responsibility is so important. Online sales is particularly difficult. We have a survey out at the minute to understand better the technicalities there and to get feedback in terms of where that could potentially be tightened or addressed.
Thank you.
Sorry, that was a diatribe. I don't know.
That was very helpful.
Pat,
Thank
could
you.
I just come back on the comments around horse owner education and just highlight perhaps why that is quite so important, in that if we are saying at the point of receiving the anthelmintic that the prescriber is going to be asking more questions and requiring more information, for the horse owner to feel confident to give that detail and to understand why they're getting all of those questions, they do need to be educated. So I do think that still remains an important part of this process, for them to understand the importance of why the prescriber needs to have all of this information to hand. It is very much a two-way street.
And I think you're highlighting the understanding why, not necessarily all the detail of all the
Yeah,
anthelmintics
exactly.
and all the
Why is
parasites.
this information needed?
But leading on to that, and I'll go to Dave and Claire, is then how do vets and RAMAs, SQPs keep up, and there's a question about this, keep up to date with what is the new, because it is moving and changing. So that's a bit of their responsibility. So if you could quickly just pick that up, Dave, for the vet, and Claire for the RAMA.
So Beaver have quite a lot of educational material available on this subject, and we're pushing quite a bit more out this year. So I think we have a fair amount out there. The science, unfortunately, isn't evolving nearly as fast as we would like. It is an issue that there isn't a huge amount of research taking place in this field. So that's a frustration. But I think there are quite a lot of educational resources there aimed at vets, but they would equally be viewable by RAMAs, SQPs.
Yeah, certainly that would be something that we would continually look at, is best practice that's coming out and new research. As RAMAs, we are required to do CPD, and a lot of that focuses around the targeted worming, the new developments, and the best practice advice. So we get quite a lot of that too in that specific subject.
Thank you. I mean, we're still getting a lot of questions, but I think I'm going to need to close this, mainly because I want to allow everybody to have a take-home message, because this is so important, and I emphasise this is about collective responsibility. So, Sara, what would your take-home message to those that are listening? And
I think that worm control and parasite burden needs to be sort of seen as high a priority as with all other aspects of our horse's health. So the science is there. It's our responsibility as professionals in all fields to get that advice and that information out there.
Claire?
Yeah, I would back that up and say, don't reach for the wormer. Let's look at testing first and then really targeting where they're needed.
Whether it's by a mandatory route or whether it's a voluntary industry code of practice, we have to get away from allowing horse owners to acquire dewormers on an ad hoc basis. They should only be able to get them as part of a diagnostic-led annual plan.
I think go and talk to others about it. We know that you can yourself have optimal parasite control and then be impacted by somebody else that brings a horse onto the same yard as you. So go out, spread the message that this is something that's a critical problem and impacts all of us.
And I think that we need to encourage all of our stakeholders right across the sector to engage in this conversation, because we need this multi-stakeholder approach.
Gosh, you were very efficient. We've actually got a few minutes. That was very unusual. So I'm going to ask just a couple of you very quickly, very short, another question is the information out there. You've given a very good coordinated response, and I'm really thank you all for thinking about how we can do it. It's not always coordinated when you're out there. For an owner, it's confusing. So again, just to take home, how do we help to resolve this as a horse owner so that you're not, you get the best advice? So quick one, yes.
Yes, I had time to think before, so start at this end.
I'll jump in then.
Go on, Dave. Go on, Dave.
I think this panel, this room, and wider across the industry, we need to be very consistent in our messaging.
Claire, anything to add to that?
No, it's just talking off the same hymn sheet, I think.
And I think this is a start of the journey, but it's the start, isn't it? And I think this initiative you're doing and involve us, and then come back and tell the NEF how you're doing. But anything else to add now you've had time to think? Alison?
No, I don't think there's anything further. I just think that we need this collective approach. That's going to be the only way forward.
Thank you. Well, I would thank you for all doing this collective and responsibility approach. Thank you very much.